Hello, I'm Dr. Soumi Malick, and today we will be talking about hypotension. Hypotension is a state where or you can say it, low blood pressure. It's a state where your pressure is less than the upper case, or the systolic BP is less than 90, and the lower case or the diastolic BP is less than 60. We will call it hypotension or low blood pressure. And low blood pressure is usually not a genetic thing, but if it's causing due to any other underlying symptoms in your body, like there are other severe or causes like hormonal disorder and other causes, that may be a genetic, but hypotension is usually not a genetic disease. Hypotension may cause due to some underlying body conditions or due to some physiological causes. Like if you are lying down and for a long time and you sit down, that is a posture. Changes in body posture can causes hypotension, and some kind of foods and drinks and medications can also causes hypotension, and lack of sleep, lack of rest, very much of stress can causes hypotension. And due to some disease, like if you have a bloodstream infection, it can cause hypotension. In pregnancy you can experience hypotension, and some other causes like some hormonal disorder and some heart disease can also causes hypotension. And in case of severe blood loss due to any accident or due to any surgery, that can causes hypotension. When we get sick, our body is in a stress due to any causes, where either you have fever or you have a diarrhea. So whenever this kind of situation happens, it's always not like we are having hypotension whenever we are sick, but we have fever or vomiting or diarrhea, in this kind of situations you have a fluid loss in your body. And also, when you are sick, probably you are not taking your food and drinking not enough water, so that can causes hypotension when you are sick. Hypotension is a thing where someone the below the BP 90 by 60 millimeter of Hg, that is the range of your hypotension. Now someone can experience hypotension in this BP, and some individual can be normal in this BP, like they have their body has adapted this blood pressure and they are okay with it. Now usually you don't do not experience any severe symptoms. Sometimes individuals does not even feel any symptoms for the hypotension, but for hypotension you can feel like dizziness, or you can be fainting or tired, you can feel tired, and you can have a bloating and nauseatic feeling. You can have all the symptoms for hypotension. Now, usually hypotension does not in daily life. If you have sometimes like postural hypotension and all, for that you may not feel any severe symptoms, but sometimes hypotension can be life threatening, and that can causes like shutdown. Your heart cannot work properly and brain does not get any blood properly. Then it's a life threatening condition. Otherwise, risk factor is like if you have severe hypotension, suddenly you can fall down due to fainting, and you can get injured by the fall. These all can happen due to hypotension. Usually, if you have a mild hypotension at home, you can drink a lot of fluids or like ORS water. You can have all this, but in case of life-threatening or heavy disease, you need to get admitted in the hospital and need to get fluid like normal saline or other fluids intravenously. So basically managing the fluid in body is the hypotension, and in case of severe hypotension, we have some drugs we need to keep. The low BP people does not always feel any symptoms for hypotension, so they may not feel anything like that. Now, a person who is experiencing this regularly or in a frequent basis in their daily life, like fainting or tiredness or dizziness, they should have if you do not get a proper BP machine, you can have an automatic BP machine which is already available nowadays. You can check your BP twice a day, like in the morning and in the evening. And also some in the morning there is a tendency to the body to have a higher BP just after waking up from the bed, and at night the BP is a bit low when you go to sleep. So these are the normal physiological process in your body. Also, the patient who are on hypertensive drug, like who have high blood pressure, those medications also can causes hypotension. So for those people, it's better to check their BP twice a day, in the morning and in the evening, so that they can get to know whether the BP is controlling with the drug or not. And in case of hypotension, if you are feeling these symptoms regularly or frequently, then you should check your BP like twice a day at home also.